Hello, everyone. Thank you for joining us. Welcome to the Avexia webinar series. Our topic for today is Power to Practice AI Avexia Diagnostic Ordering Integration. Today, I have the distinct pleasure of being joined by an exciting guest, Vinny Frangella, who will be our presenter for this webinar. Vinny Frangella has spent 2+ years helping functional and integrative medicine practices grow smarter through Power to Practice. His approach is consultative, not transactional. He works alongside clinic owners to implement best practices in clinical operations, leverage group purchasing discounts, and build the kind of efficiencies that turn a good practice into a thriving one. Vinny's belief is that Power to Practice isn't just an EMR. It's the system that connects providers to a network built for their success. Without further delay, I will now turn the webinar over to Vinny.
Hello, and thank you for joining me today. Taking time away from your busy day and away from your patients means the world to myself and Power to Practice. My name is Vinny Frangella, the Director of Sales at Power to Practice. Very excited today to talk about our deep partnership and integration with Avexia Diagnostics and what we have been able to do with our mutually supported clinics when it comes to lab ordering within our EMR system, Power to Practice. For those that don't know or are not familiar, Power to Practice is an EMR built for functional and integrative medicine. We work with clinics running specialty care models such as functional medicine, BHRT, longevity, concierge, and integrative care. Also supporting clinics with IV therapy and aesthetics as part of their offerings. The clinics that demand depth in documentation, flexibility in workflows, and speed in execution love working with Power to Practice. Our job is to get your team out of the administrative overhead and into patient outcomes. That means connecting the tools you need, automating what slows you down, and building workflows that actually match how you practice medicine today. One of the biggest friction points we hear from clinic owners and operators comes from lab ordering and lab cost. You're juggling multiple platforms, managing different pricing tiers, and your patients along the way are getting sticker shocked at the cost of traditional labs post-insurance reimbursement. Well, Power to Practice and Avexia Diagnostics are here with a solution. Now let's talk about why Avexia and Power to Practice are so mutually beneficial for clinics. Avexia is built the same way that Power to Practice is. They are obsessed with functional medicine labs, functional health reporting, and patient-friendly pricing. They get and understand the cash pay model. They understand that in specialty medicine, you need labs that go deeper than the standard reference ranges and where insurance deems a lab medically necessary or not. When we integrate together, it is not a bolt-on solution. It's a deep ingrained partnership between two companies that speak the same language and serve the same clinics and patients. So what's happening right now at most clinics? You might be ordering from multiple lab platforms outside of your EMR. Some ordering might be embedded in your current day EMR solution while other lab companies are not. That's context switching. That's administrative overhead. And that's friction in your workplace, potentially keeping you from seeing many, many more patients from a day-to-day perspective. But most importantly, your patients are paying insurance-inflated prices or out-of-pocket costs that are way too high. That is potential money left on the table for the both of you. Savings for the patient, full transparent pricing for the patient, paid to a trusted source in the clinic that they receive care in, and not being sticker shocked by that price 30, 60, sometimes even later down the road, halting that patient from getting the answers and getting the great plan of care that you and your providers plan to lay out for that patient. The other huge missing gap is every single time that you allow and print that super bill for a patient, the potential lab revenue hitting your bottom line walks out the door with that printed super bill. My team at Power to Practice has years and years of operational excellence and support. We would be happy to look and optimize your clinic to structure a cash paying lab program that makes sense for the clinic's bottom line and for all the patients in your census today. So let me break down where a few immediate value props from rolling out a deep integrative cash lab program like the P2P and Avexia Diagnostics create. First is going to be seamless lab ordering. You're ordering directly from your preferred labs right inside of your patient's P2P chart. That's efficiency. That saves your team time every single day. Time is money, and those daily time savers add up to weeks, months, and years of time savings. Secondarily, patient affordability at scale. Avexia's cash pay model means your patients can save upwards to 80 to 90% compared to traditional billing through insurance. Insurance will no longer dictate to your clinicians the decisions for what labs can or can't be run. You will be in control. You and your patients together will mutually agree upon what labs are necessary to get the answers and results for that individual. That is functional medicine at a core, and this is what this partnership brings to life. Lastly is the revenue opportunity. By using competitive pricing and a streamlined process, you are able to enhance your bottom line while providing your patients with something they actually value: affordable, high quality testing paid to a trusted source that they already get care from. Now I'm going to run through a couple selected slides here. I'll let you guys comb through the rest at your own accord, as I know this will be sent out as part of the webinar. Again, the partnership is here to create seamless efficiency across the board for your clinics, built right into your EMR. As you guys know, Avexia Diagnostics is a wonderful lab marketplace company, creating a unified way to access many labs from standard to specialty labs that will help patients on a day-to-day basis. Where our partnership can help you. We hit on these a little bit earlier, so I'll zip through a few of these, but seamless lab ordering straight from your patient chart. You'll see that in action here in a couple minutes. Enhanced patient care due to the cash paying lab model, allowing patients to get these lab requisitions right away and not have to deal with insurance reimbursements or turning that back around to say, I need more notes of medical necessity there. Also, cost reduction provides discounts on cash paying labs, sometimes upwards of 90% for patients. It also, like we mentioned, can boost the bottom line productivity and profitability of our clinics. A fully cash paying lab program can 100% offset the cost of a P2P subscription. We have many clinics that are utilizing this integration just exactly that way today, and running a business, running their clinic efficiently is paying for their EMR EHR system. We would love to get each and every one of your clinics there. So looking forward to talking. You'll see a couple call to action links. Feel free to scan the code right behind me and set up a little time to talk to me and my team. As you guys are pretty familiar, some logos of the top labs in the lab compendium available today via this integration. Couple frequently asked questions before we get to my demo. If I already have a Avexia Diagnostics account, can I access labs instantly? Yes, you can. Give my team 1 to 2 business days to plug in your account number and get that integration humming back and forth. Will I have access to every lab Avexia offers? Yes, you will. You will see that in action. You'll have the full compendium for each lab company available via Avexia Diagnostics, and you will also have the ability to save groups of panels. So think about your commonly ordered panels. If you run labs on your initial patients, maybe one is slightly different than the other. Seen a lot of different lab panels, male to female. So you could save those. That way you don't have to recreate that 6, 7 lab panel test, whatever it is at the clinical level, every single time. All right, so rather than go through the screenshots, feel free to click through those as you want. I'm actually going to jump into a actual little demo account here so you guys see this in full action. All right, so first and foremost, some of our P2P users that are watching this video might be like, whoa, this is not like my P2P environment today, and it probably is not. We have just rolled out P2P AI, which is our newest model of Power to Practice, which, as you can guess, has AI layered in throughout, with the ability for scribe and dictation services to be enabled on a per provider level, and then free AI solutions throughout the platform for AI smart scheduling, lab and RX automation, in addition to visit summaries for the provider that can be released in a patient-friendly version if the provider would like. Along with the AI features and functionality, as you guys can see here, full new user interface, a lot more functionality and key features here that we have really learned best practices and taken them from what we've learned from our years supporting functional medicine clinics and empower them in our new solution. So better tools when it comes to care gap management, better tools when it comes to patient re-engagement, better tools when it comes to comprehensive memberships that can include standard sets of lab panels like we're discussing here for Avexia Diagnostics. And then you will see a way that we could visualize lab trends, which goes along with what I'm about to show here. So plenty of new things to show to our current Power to Practice clinics interested in utilizing the Avexia partnership more. And if you're using a different EMR, we would love to talk to you about what Power to Practice does today, how deep our integrations are with great partners like Avexia Diagnostics, and what we could do to give you, your clinic, and your patients a better EMR, EHR to bring your clinic to new heights. So let's get into the demo here. First, we're actually going to make an order for Macy Lynn. One of the cool new features, you have the ability from one tab to have multiple patient charts up and toggle between them via one tabs versus multiple. Here's a little example of that AI visit summary, so you guys can see that. Clinician view, patient-friendly view. But if I'm going here to order labs, I'll go down here to the lab section, and then I'm going to click here to add a lab, new lab, and then lab setup is done by our customer success team, where we will ask upon onboarding for all of your lab account numbers. We have plenty of different integrations in addition to the Avexia integration that we're speaking about today. So those will be reflected here due to clinical setup to keep your account numbers private to obviously those that should only access those numbers. So let's say I'm ordering from LabCorp. I'm going to start searching as my type that in. You see that that is smart searchable. You'll look for the Avexia tab in the green logo. So you know that this is going to tap into the Avexia discount pricing that we offer to all of our integrated parties and will allow you to have those saved lab panels. So we're going to click on that. Actually, sorry, let me discard this. Sorry, I need to add a email address here. Give me 1 second. Right. Go ahead and save that. Get back up here to labs. They obviously need an email address on file so that they get a copy of this requisition. All right, so let's say I wanted to use my glucose panel that I pre-built that does include, if you ever have a question, you see as I selected that, the 2 tests come up here, but so do they if you drop down the caret. You also see that discounted price that taps into that integrated discount fee schedule that we have via this partnership here. This is only a subtotal that is displayed internally to the clinic. This is not going to be pulled over to the fee schedule. This allows you as a clinical decision maker to run and operate your practice how you deem fit. We have plenty of clinics that are passing along these great savings to the patient one-to-one. We have other clinics that want to make a per dollar amount margin, and they set that fee schedule up accordingly. And we have others that want more of a percentage margin to that. So we work with each and every clinic differently and set them up and aid and adjust their fee schedule according to how they want these cash labs handled when it comes to patient pay. So we have a couple things here. Patient pay, that would send the email to the patient, like I just added here in this demographic sheet. And then they would have a bill that they would need to pay Avexia Diagnostics before that turned into an actual ordering requisition. So I always suggest it is best to go, even if you plan to pass these savings along to your patients, go to the clinician pay option. That is going to have you get a bill from Avexia Diagnostics for anything that you order, net 30-day terms. That is then going to allow you to set your margins and run your fee schedule and collect payment yourself, going directly to the bottom line of your clinic and your practice there. You also have the ability here, if you wanted to add on another test, you could very quickly do that here. Oh yeah, sorry, I need to select one with the pricing. And as you see here, I added another $5 CBC test, which brought my total from $12 to $17 for this patient. We're going to set a date to draw to the 31st, very end of this month. We're going to make this visible to the patient in the patient portal. And then I'm going to click here to create and submit an order. Now, this is my demo environment here. So in the real live production environment, this flows over very quickly. This is probably going to take anywhere from 15 to 25 seconds for this to get over in the staging environment that I'm in right now. Avexia gets a copy. So if you log into your Avexia portal, you'll still have the same requisition that you just ordered from your patient chart in P2P in your Avexia portal that matches one-to-one. As you see here up in the right-hand corner, a green pop-out icon came in stating that this was successfully sent over to Avexia. Now this is where my staging environment just has a little flag for the downloading. And then if we wanted to see how results came in, I'm going to go and find another patient with some results. So I'm going over to my patient icon here, looking for my guy, Ken Tester. So let me bring up Mr. Tester. All right. So as you see here, Ken has a few more orders than Macy does. But if we wanted to see the results for Mr. Tester here, let's say I opened up this Avexia Diagnostic Lipid Panel. Couple things I could do here. You have an audit trail, so you could see when the requisition was created, when it was submitted, because we do have the ability to save and order into draft if it's not quite ready yet. Then when the results were received, and also when our provider, who I'm acting at right now is Cassandra Jones, reviewed and signed off on these results. Then you can download the PDF, one click right there, while you also get the full results here with the value biomarker by biomarker, units of measure, reference ranges, and then any abnormalities flagged high or low. Then you can jump back out and get to any other results than orders that you guys are looking for. We also have the ability to trend out our data. Now, this is just sample dummy data here, so you're not going to see the ebbs and flows that you would on a traditional multi-RAN blood report or urine sample here, but you will be able to have it all date and plotted over time for your patients. So being able to look at the lab trends along with maybe a life event that recently happened in your patient to tell the story of why a cortisol level might be spiking on a recent blood panel. That is where obviously our integration goes a level deeper with Avexia Diagnostics, being able to take the discrete data, still display the discrete data, but then take each biomarker and trend it out over time. The last thing I wanted to show to complete the full story for everyone is a little bit about our membership build out and membership tiers. As we see more and more functional integrative medicine care is moving into a membership model for 6 months to annual care models that include some sort of provider visits, maybe some nutraceuticals, some lab work, maybe even a pharmaceutical medication or custom compound there. We are incentivizing all of our clinics to build out robust memberships for the health of their clinical bottom line. We now have a very robust membership package and portal here that allows you guys to offer the latest and greatest to your patients. So right now I'm editing a platinum membership. We do have a delivery model of in-person and virtual. Our next push will have a blended model because we do see that more and more clinics are offering telemedicine along with some in-person care. But you'll give a little description that will be displayed on your menu board of your patient portal if you would like, so that you could have members self-enroll and sign up themselves after an initial visit and establishment of care. We will also be able to show a monthly cost, daily cost, quarterly cost. And if you're offering a discount for someone paying you annually, you could offer that then and there. So I kept math simple, $450 a month. And then the annual cost is only charging for 11 months. So you could see here that it lists the per month cost, but down here, a savings of 8% for an annual. Then the benefits: 4 provider visits, 6 IVs of choice, 4 free supplements, 20% off additional supplements, and 2 blood panel lab test. You also can control your commitment period, 12 months, 6 months, a grace period, when does billing start right away, and also control your early termination fees. Visit types, this is where you're uploading what visit types they get. Is it a 45-minute follow-ups? Is there 160-minute initial? And again, as they enroll in memberships, this knows when it comes to checking out a patient invoice-wise. The count of using a 45-minute follow-up is going to go down from 4 to 3 in this hypothetical. And then that invoice is going to know to not charge that 45 minutes since this is an active enrolled member. Services, this is where you can add your standard blood panels that you're running on a patient there to, again, control your cost, understand what you're paying Avexia Diagnostic for a glucose panel, a initial male hormone panel, a initial female panel, whatever it might be there, and then being able to tie that into a comprehensive membership model where maybe there you're collecting your margins. The other cool thing that we've done here on the blood panel is, let's say we were selecting that service to be included. We say 2 per cycle, and then I wanted an even spread because that's going to say every 6 months they get access to utilizing the blood panel that is included in the Platinum membership. You also can do these all immediate if you want to, or a monthly allowance, or a custom phased in schedule, again, depending on how you see your patients, how you see memberships getting adopted with your patient census there. And then a couple other little things, you could add products if you're selling and offering products to your members. Benefit banks are going to be additional banks. Most people leave these defaulted off, but if you're offering things like discount on, if you're selling apparel at your store, or giving, gift cards or credits to certain members to allow them to incentivize giving that away during the holidays to refer a patient back into you, a great use of this is going to be the benefit bank. So I know everyone saw a ton here today. I really want to highlight what exactly our powerful partnership between Avexia Diagnostics and Power to Practice is doing for clinics. This isn't about adding another tool. It's about removing friction from the workflow that you already have, while giving your patients better access to labs for the results and the answers they want, along with more transparent and better pricing than insurance gives today. If you're currently using Power to Practice and want to integrate Avexia, or if you're exploring cash paying lab options for your clinic, or considering making an EMR switch, I would love to have conversations with each and every one of you and talk about your unique clinic today, your needs, and how we would best structure your clinic for success utilizing our powerful integration. Please scan the QR code behind me, or feel free to message us at sales@powertopractice.com, and we will get you taken care of. Looking forward to each and every one of your conversations. I hope you found value in today's brief little webinar, and I look forward to customizing this workflow, memberships, and solutions to uniquely fit into your clinical and patient needs. Take care, have a wonderful day, and I look forward to talking soon. Bye-bye.
For any questions or issues, you may have contact Avexia Diagnostics by email at info@avexiadiagnostics.com, or by phone 5 days a week at extended hours, 8 a.m. to 8 p.m. Eastern Time at 888-852-2723. Thank you, Vinny, for this informative presentation. Thank you again for joining us for this webinar event. Until next time, from everyone at Avexia Diagnostics and Power to Practice, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.